I'm Executive Director Kevin Robertson, and this is the KDA Video Minute for Friday, May 2nd. Well, we've gotten through the legislative session. Of course, the KDA General Assembly and all our meetings were last month with the Midwest Dental Conference. So moving forward, we'll be looking to do a video minute on the first Friday of every month. We'll do more if necessary, but that's when you'll be able to find those in the months ahead. We're going to start off today talking about Medicaid. As you know, during the legislative session, we did get an increase in Medicaid. As great as that was, it wasn't quite as much as we had requested. The request that the KDA made of the legislature would have put Medicaid on par with commercial insurance programs. Less than that was actually allocated. So now we're in the process of trying to determine, working with the Division of Medicaid, where would be the best places to put our money, or ask the state to put their money in increasing rate. Earlier this week, you would have received a survey from the KDA asking you to talk about Medicaid, to list different procedures and to rank those to help us as we work with the Division of Medicaid moving forward. So please find that and do that, and we appreciate your assistance. Under the topic of Medicaid, the KDA is working with Oral Health Kansas and several partners on an initiative called Pathways to Oral Health. That initiative is to help persons with disabilities receive access to dental care. We talked about Medicaid increases for the rates for those dental providers. Also, as part of the package that went through the legislature last year, there was an increase in sedation reimbursements. If you're doing sedation in your office, or if you're hiring a CRNA or someone to do sedation, their rates would be increasing as well. And then also facilities, hospital operating rooms or other facilities where you might be doing sedation dentistry, their rates would increase. All as a package to try to encourage more access to persons with disabilities. What we would ask you to do with regard to that is find the Pathways to Oral Health website. The link can be found on the KDA website. There's some information on signing up to become a Medicaid provider. There's also information on what we call My Dental Passport. That is a passport where persons with disabilities would fill out information with regard to their needs when they're seeing a dentist, and would provide that information to the dentist to help with their care. So that is something we're asking our members to take a look at, to be aware of in case someone does provide that information to you. Maybe help encourage persons in your dental practice that are patients to help use that tool as they move forward with their dental care. Part of the Pathways to Oral Health process or program is to hire a dental facilitator. Brian Thompson is the person who's been hired as a dental facilitator to work with dental offices on getting credentialed, applying to be a Medicaid provider, working through claims and other problems and concerns you might have with CanCare or with your dental Medicaid. Use that person as a resource to help ease your burden of being a Medicaid provider. Again, My Dental Passport, increase in Medicaid reimbursement rates and other reimbursement rates, and we also need an increase in the number of providers providing dental care. That's where you come in. We'd like you to be involved and contact the Kansas Dental Association if we can provide other assistance. We'd like to talk about the Kansas Dental Association's new Leadership Academy, where we'll be shaping dentistry's leaders of tomorrow. That program is set to start on September 11th and 12th of 2025 with a leadership retreat. We would love to have new dentist members and dentists maybe that have been members for a while that are interested in building confidence and becoming leaders of organized dentistry of the KDA and maybe at their component level. So we'd like you to contact the KDA. We're going to be putting together leadership modules, personality profiles, information about dentistry, organized dentistry at the state, local, and national levels to help build that confidence. And we'll be set for a graduation to be held on April 24th during the Kansas Dental Association's General Assembly next year during the Midwest Dental Conference. It's all in all a 6-month program meant to help build confidence and shape dentistry's leaders of tomorrow. If you would like more information on the KDA Leadership Academy, you can contact me, Kevin at ksdental.org. We'll be putting together a little application process to help with that. Look forward to hearing from you about the KDA Leadership Academy. That wraps this edition of the KDA Video Minute.